and welcome to the Amplifying Scientific Innovation video podcast. I'm your host, Dr. Sophia Ononye-Onyia, founder and CEO of the Sophia Consulting Firm, a WeBank certified life science marketing and communications consultancy that was established in New York City with the goal of amplifying scientific innovation. The goal of this podcast is to showcase the importance of science advocacy, health equity, and influential leadership through conversations with senior life science leaders who share their unique perspectives on their leadership journey, corporate vision, and industry outlook. My guest today is Ms. Carmen Villar, Vice President of Social Business Innovation at Merck Co, where she oversees the Merck Foundation, the Merck Office of Corporate Responsibility, the Merck for Mothers, and Merck Global Population Health. Known as MSD outside of the United States and Canada, Merck's mission is to save and improve lives around the world. I connected with Carmen following her remarkable panel participation in the February 2021 Health Equity event facilitated by the Healthcare Businessmen's Association, more commonly known as the HBO, where I serve as the chapter president. Moreover, Carmen and I have so much in common, including living in my native land of Nigeria, and she's also facilitated introductions to other senior leaders at Merck, and even organized Chief Communications Officer Wendy Lund, who will also be a guest on this season of the podcast. Welcome to the show, Carmen.
Thank you so much, Dr. Sophia. It's great to be here today.
It's my honor and pleasure. So I always start the podcast the same way, but before I do, let me just comment again on how much I love your background. It's very festive. Along those lines, scientific innovation really is a celebration. So what is your definition of scientific innovation?
Sure. You know, it's interesting. I tend to be a little bit old school in my thinking about scientific innovation because having lived, as you mentioned, having lived and worked around the world, I think there are some areas where we don't necessarily get the delivery mechanisms right. The existing systems need work. And I feel strongly that until we can get the more traditional delivery systems working, that innovation is hard. Hard to support and hard to put in place. The one thing I would say, though, that I'm really excited about right now is when we think about blockchain technology and we think about our supply chain around the world, and we're learning more and more about that. And at Merck and MSD, we are really looking at how can we ensure quality in each part of that blockchain or that supply chain? And how can we actually track important medicines, the quality of medicines, and then get customer feedback and patient feedback? And so I'm very excited about thinking about that from more of a systems approach. But I do have to say that getting shots in arms in terms of vaccines and getting pills in mouths are still my very traditional way of thinking about innovation, because if we can do that, we can solve a lot of problems.
Absolutely. I love your global view. Obviously, we share a similar view around health equity, around access, and how we actually innovate and improve our existing delivery systems to make sure that the innovations get to all people. And it also ties into Merck's mission, which is, of course, to save and improve lives around the world. So that's an impeccable definition. Now, you sort of alluded to this earlier, but how did living in Africa, including, of course, my native land of Nigeria, influence your interest in addressing health equity?
Yeah, sure. Well, I should say a couple of things first. One is that all the countries in Africa are so different. And so you mentioned your native home of Nigeria, where I walked into my new job and my new home, and the country, the people really embraced me, really welcomed me with open arms, invited me to their houses for dinners and celebrations. And it was just such a lively, interesting place to be. Whereas I had been in Zambia for 3.5 years before that. And it took me a while to get to know people. And although everybody was very nice and very welcoming, those personal invites and those things came a little bit later, I think, after trust was built. But I make that point because some people, especially in the US, just sort of think of Africa as one big thing. And it's not. It's a very healthcare is managed much differently depending on where you are. And so I bring this example forward as saying that local management of healthcare and individual management of healthcare is so, so important. But when you don't have the right tools and you don't have access to those tools, that's really where you think about equity. And that's what really got me thinking more and more about, it's not just about the color of your skin or where you live. It's the community that you're born into, the people you're surrounded by, what they may do for a living. It's that population health view.
Right.
And what I saw in Africa, especially in the early 2000s and mid 2000s, when I first moved there, was people were, we know this, but people were dying of AIDS. People were coming to clinics in wheelbarrows, emaciated on their deathbeds, whereas we knew that antiretrovirals were available in lots of other countries. So it really was important to understand that by coming in and working with local governments and working with local communities, that we could provide an intervention that they otherwise perhaps did not have access to. And that's really what we did. And to see that turnaround from that patient in the wheelbarrow, as I mentioned, coming into clinic for the very first time, to that same person being strong and healthy and riding their bikes through the village as a peer counselor and talking to other patients who needed their help or perhaps needed education around HIV. It was really an amazing experience for me to see, but also instilled in me, sometimes it's just that window of access, that window of opportunity that somebody needs to really push through and either improve their health or improve their situation. And it really was enlightening for me to watch over the few years that I lived there, how that could transform somebody's health and somebody's outlook on life.
Right, right. And one of the things that stood out to me as you spoke is not only is Africa a continent, people sometimes refer to it as a country, but you have that diversity in terms of the cultures, that even within Nigeria, there's the North and the South, etc. And then you go to different countries, and the countries that are perhaps more exposed to technologies and such will be more open-minded to innovation, and those that are not so much. But it takes that type of grassroots experience really to shape policies that can actually be effective, right? Versus just thinking you know it all sitting from your computer wherever you are in this world, right?
Well, and that's exactly what I say. People who are very into scientific innovation, developing new interventions for people on the ground or people who need that innovation, I really try to encourage them whenever somebody comes to talk to me or ask me about my career or questions. See, look, the most important thing you can do is work on the front lines, whether that be at a local health department, in a clinic, or abroad somewhere in another country, where you're interfacing not only with the systems and the ministries of health, et cetera, but also with the patients. You understand the day-to-day situation, because that experience only makes you better when you're thinking about how can I help the healthcare system on the whole.
Wow. Wow. I love it. It's a very holistic view, and it's one that is, again, balanced by a real life experience. But this is not the only remarkable experience I want to comment on today. So I would like to learn more about what inspired your transition from the public health sector at the Centers for Disease Control and Prevention, CDC, to your current role as the VP of Social Business Innovation at Merck.
Sure. It's important for me to say that I spent 20 years at CDC and I loved every minute of it. I went there as a presidential management fellow, and I thought I'll be here for a couple of years and then I'll go to my native California and I'll find another job and, you know, everything will be fine. But we went there, my husband and I, for this 2-year fellowship, and we ended up staying for quite a while. And what I loved about it was the diversity of experience. I got to work in breast and cervical cancer control and prevention programs. I got to learn about management and operations and grant making. I worked in HIV. I was there when we started the bioterrorism preparedness and response program. So I had a wide variety of experiences, and I was able to live and work overseas, as we said. And when I left Nigeria, I came back to Atlanta, to the headquarters of CDC, to serve in a position as chief of staff for the agency with Director Tom Frieden at the time. And it really was a wonderful experience because I had a macro view of the agency. I got to see a little bit of a lot of different activities, and it was fantastic. And I got to work in areas in chronic diseases in particular, and injury prevention and control, where hadn't had a lot of exposure in my life.
Right.
So I really had that diversity of experience. And when it came to the end of my tenure in that position, I really kind of looked around and said, I've had really great experiences here. What are some of the gaps in my career CV? Where can I learn more and continue to grow? And the private sector was something I hadn't really explored before. I had worked in nonprofit, I had worked in government, I had worked in politics, but I hadn't really been in the private sector. So I got reconnected with Dr. Julie Gerberding. She happened to be looking for this position, a vice president position, to fill this role. And after about a year of talking and thinking and interviewing and so forth, I decided to make the move. But I have to say, what inspired me the most was when I met with Ken Frazier, our just retired CEO. He,
Yeah.
I said, Ken, I'm a little bit worried about coming into the private sector. They're so different. And some people say the private sector is not such a fair and equal player. And I don't know. And he said to me, Carmen, you can stay where you are and you can continue to do great things and provide a public service. Or you can come to Merck and you can do some of the similar things with the full weight and support and resources of the company behind you. Now, I leave it to you, he said to me.
Wow. Wow.
So I couldn't, once I heard that, I just thought, this must be a fantastic place to work, and he's a fantastic leader. And if I truly want to get some private sector experience and learn about the rest of the systems involved in delivering healthcare, this would be a great opportunity in which to do so.
And the rest, as they say, is history. But what you just shared about your conversation with Ken Frazier, in addition to, of course, your 20 plus years of experience at the CDC, is what what we should all call influential leadership. Because Ken did not say, hey, come to Merck, but he said, if you want to elevate your experience, go above and beyond, right, in terms of the impact that you have in your work, come to Merck. And you did, and it's been remarkable, I'm sure.
Yes.
Now, as we continue to focus on Merck, you all are doing some really exciting work in the health equity space. I'm very curious about one in particular, but I would also love to hear about some of your new initiatives, such as the Merck Foundation Alliance for Cancer Care Equity.
Mm-hmm. So let me talk a little bit about that. Last year in our team, we decided we had been doing lots of great work to address a lot of the issues around social determinants of health. And through our history, we had supported programs like the Merck Donation Program, Merck for Mothers, et cetera. And last year, in light of some of the events happening in the world around COVID and George Floyd and so forth, and this re-highlighting of the disparities in health and access to care and vaccines and such, we really decided that we needed to have at the enterprise level a health equity team coordinating activities and thinking about strategy more broadly. So we did that, and it's been a little over a year that team's been in place, and the response from inside the company has been tremendous. People were already doing great things, but they became even more inspired by having this leadership team in place to help them think through the strategies, think about best practices, and really learn from each other across the company. So I'm very, very excited for this continued work. But I will say that, as you mentioned in the beginning, the Merck Foundation is within my remit and part of the organization that I oversee. And for a long time, we have been supporting programs in HIV and diabetes and Alzheimer's and such, where we really try to address some of these social determinants of health. But most recently, the Merck Foundation has announced the Alliance for Cancer Care and Equity. Cancer Care Equity. So equity in cancer care. The new initiative is really designed to improve the delivery of patient-centered equitable cancer care in the United States. And the Merck Alliance for Equity in Cancer Care aims to address persistent disparities across the cancer care continuum. We just announced this initiative earlier this year. It's a $20 million initiative over 5 years. We asked for letters of intent to apply, and we received quite a few, and we're going through those now, and then we'll invite some full applications, and by late first quarter, early second quarter, we should be able to announce the recipients of these grant awards. But I really do want to say something for people who are living with cancer or have recovered or are in remission from cancer. We know that patients, when they hear the word cancer for the first time in their doctor's offices, they don't really hear much else, right? After you hear you have a diagnosis of cancer, the rest is sort of a blur. And the system is complex. And I can say this honestly, because my mother's just going through this now as she was diagnosed with breast cancer. And I think about all of the different specialists and generalists and care providers that are involved in that continuum of care, including she's fortunate that she has sort of a case manager that helps her navigate all of this. But not everybody is that fortunate. And we saw that a lot of patients in the cancer care continuum were really facing some challenging barriers, driven by the social determinants of health, where they live, how they get access to transportation, what kind of resources available to them. And physicians were also kind of saying the same things. We need to help get the patients the support they need in a way that makes sense, both for the care that they need and for the patient.
Yeah.
So this alliance is really designed to do that and respond to the needs by helping patients get the care that they need through navigation support, referral to community resources, mental health care, improved communications with providers, et cetera. So you get the gist, but I think that it's important for us to think, as you said earlier, the whole of the patient, to have
Right.
a holistic view and
Right.
really start where the patient is.
I mean, I'm very excited about this. First of all, I hope your mother is doing well. I was a breast cancer researcher at the Yale Cancer Center, and I know that cancer care equity was something that we talked about because I was focusing on triple negative breast cancer, which predominantly affects women of color, especially Black women. So I think that this is obviously a step in the right direction for Merck, and hopefully there will be grant awardees that will benefit from this and can continue that impact that we all want to have in terms of saving and improving people's lives all over the world. So thank you for sharing that perspective. Now, I'm thinking to take a few steps backwards and then focus more on a macro view.
Sure.
What do you think? What do you think are some unique challenges that women of color face in leadership positions in big pharma or the public sector? And what coping strategies have you adopted over the years?
Sure. Well, you could probably answer this question better than me, Dr. Sophia, but I think, the biggest and most obvious challenge is that you don't see a lot of people that look like you in the room, and I think that it's hard to really look around. So many times you just need an affirmative head nod or a smiling face or somebody to show you a little support that you're saying and doing the right things in that room. And if you don't have that, or you don't have someone that looks like you or understands what you're going through, that can be a huge challenge. And so I think I really try to develop peers and mentors and allies that can help me in those certain situations. And even though they don't look like me, getting a little affirmation from them is really helpful when you're in the room. And I think I would also say, asking for help when you need it. People, there's so much that happens in a meeting or in an interaction, but there's a lot of work that goes on, and people don't always think about this behind the scenes prior to the meeting. Who's talking to who, and what are different people's agendas? And I think that learning that and understanding that really helped me just to be a better leader and a better advocate for my position. And that's a tough one. I'm sorry, my computer is making some noise here, but that's a tough one for people to realize. And I think, that you learn as you go, but having those allies to help you and teach you is really, really important.
That's remarkable. So you mentioned peers, mentors, and allies. That's a very powerful network, obviously. So are there any notable mentors that you can think of that have helped to shape your career journey to date?
Oh, yes, definitely. There are many. There are many. I want to say first and foremost that probably one of the best supervisors, managers I ever had was a gentleman named Dr. Alan Greenberg, and he's now at George Washington University. But he was really instrumental. Not only did he give me support and sort of pearls of wisdom about his leadership journey and mentorship in that way, but he also, what was unique about that relationship is he was an advocate on my behalf. So when positions came up or people asked me to come and work with them and do different projects and so forth, he would kind of say, Carmen would be great at that. Or, Carmen, maybe you don't want to do that. Maybe you should pass on that. He was very good about advocating on my behalf.
Mhm.
And it allowed other people to not necessarily just take him at his word, because, when people are interviewing you or thinking about you for jobs, they need to meet you. They need to know it's a good fit personality wise and all of that. But it allowed, again, that door to open. Well, if Alan says she's a good egg, maybe we should talk to her.
Mhm.
And so the advocacy from supervisors and mentors is so, so important. And Alan was one of the greats in that way. And I know he's still mentoring and helping so many people in the public health field. And I really thank him for that. I've had lots of others who have inspired me and continue to inspire me today. I think about folks like Helene Gale, who now runs the Chicago Community Trust, and she and I had the opportunity to work together early on in my CDC career. I think about Dr. Julie Gerberding, who I'm working for now at Merck. I mentioned Ken Frazier earlier. I've been really fortunate in that I've been exposed to really great, intelligent, inspiring people along the way, in which I've been able to glean. Sometimes it's not even by talking to them or knowing them that well, but knowing them enough to understand their style and see how they comport themselves and how they interact with staff and so forth, and learn from those interactions. So I think I have been very fortunate, and I think of all of these people, but I also think about people I work with and see and talk to every day, because there's so much we can learn from each other if we just open up and either collaborate across work streams or just talk to each other and provide support to one another. So it doesn't always have to be, your superior or your manager. We can learn a lot from each other.
Yep, knowledge is truly universal. I think, to your point, we can learn from each other. But also, I'm happy to also see that you've had mentors like Dr. Greenberg, who are also sponsors for you and facilitate opportunities for you and speak up for you and all that good stuff. So I think that is part of that, very important network that we all need to find, identify, create, establish, so that we can be successful in any field.
Yeah. And what I say to a lot of folks is, listen, I'm going to support you and mentor you and give you advice if you want it, because, if I can help you in any way be better, I will do that. I said, but also someday, you don't know what's going to happen. Someday I might be working for you, or I might need to come to you for a job and support in a promotion. And that's okay. So the better off we all are, the better off I know that we will be together.
That's wonderful. And you sort of mentioned a few technologies in your definition of scientific innovation. I'm just curious to know that any other technologies that you would like to talk about based on their potential for maybe improving health literacy, access, or quality.
Sure. Well, I did mention the blockchain technology, and even in the way of health literacy, actually, where we can provide electronic leaflets for patients through blockchain. We can actually update the medical information or the clinical information immediately. You don't have to wait for the next iteration of the paper version of the pamphlet or the leaflet to come out. So that's a really exciting technology when we think about health literacy and access, because going straight to the source without having to wait for that piece of paper, talk to your provider, or all of that is really, really exciting. But I think that there are a lot of other technologies which have enabled innovation that I'm really excited about, right? When we think about what's happening in COVID, for example, and we think about some of from a Merck perspective, our antiviral medication that's currently in the application process for EUA with the FDA, that is R&D innovation, right? We had to use our innovative minds and scientific technologies to help us on that journey and to help us work together with the partners to bring that product to where it is and to advance it further. If we think about some of the other technologies in terms of delivery mechanisms, for example, implants and reproductive health delivery mechanisms and products like Nexplanon and things like that, that we have worked on in the past have really improved access in situations where perhaps reproductive health issues are not as acceptable, or we don't talk about it, or people don't want to see you taking a pill every day. So women who find themselves in those situations then have access to these ongoing delivery mechanisms that people don't necessarily have to see or know about. So I think there is a lot going on in our world, including, this little thing called a mobile phone. We are working with a lot of partners around apps that provide health education through our Merck for Mothers program. We have an application we're working in partnership to develop around how people can ask questions about family planning. And if you live or work in a community area where perhaps family planning is not readily available or discussed, you can ask anonymous questions about anything related to family planning, and you will get an answer based on facts and information and science back to you on your phone. And that's called NIVI, N-I-V-I. And that's an application supported through our Merck for Mothers, or MSD for Mothers program. So there's just a few examples of some great technologies. And I know, again, Sophia, and I know you know this, that a lot of the world went straight to this technology.
Right.
They skipped the landline and the wiring and all that stuff altogether. So how we share information and think about how to utilize that device is really critical. And there's a lot of work right now going into that as well.
Yeah, I mean, as you mentioned earlier, knowledge is universal. And I think what you speak of is this sort of advent of the data-enabled patient, which is all of us. And what we're trying to figure out in terms of innovation is how do we facilitate a faster, more real-time exchange of information between patients and their phones and providers, as well as innovators like Merck, right? So how do we get in front of the next pandemic, right? To make sure that we're properly armed to fight, to protect what's most important to all of us, which is our health. So thank you again for that great overview.
Thank you. I do want to say, if I could just say one thing, Dr. Sophia, about what you just said, because this is so important. As a society, we tend to respond to these kinds of emergencies, whether they be COVID, whether they be, other kinds of HIV or Ebola or whatever it might be. And then once we get over that issue, or we have it somewhat under control, we tend to forget the advancements and the preparation and the readiness that we've put in place. And so I just want to remind this audience that COVID is not over. Yeah. However, when it is in a place where we think it might be over or more manageable, we cannot forget that we need to be prepared, that we cannot let all this infrastructure and all this work and everything that people have done over the last few years go to the wayside. We really have to keep our readiness skills enabled and really think about and be prepared for the next thing so it doesn't catch us off guard.
Get prepared and not panicked. So are there any other comments or thoughts that you like to share with our audience before we wrap today?
No, I just really want to say thank you for doing these podcasts. It's so important to get the information out there. I really appreciate everything you're doing. And listen, if people don't understand something, ask questions. Right. Be your own advocate, because it's really your health. There are a lot of services out there, but it is complex. It can be challenging. And if you feel like you can't advocate for yourself, find a friend or a family member who can help you advocate within the system, because the services are there and we want to keep everybody healthy and living for a long time.
Wow, extremely well said. I think you have to be your own advocate in all aspects of your life, so especially, of course, your health, because your health is your wealth. And that's the most important currency that we have today. But we also have human currency, which is always going to be important. So thank you for gracing us with your presence today and for sharing your knowledge, your wisdom, and your cultural experiences, as well as your professional experiences with us. It's been an honor and a pleasure. Thank you, Carmen.
Thank you.
All right, have a good one, okay?
Okay, you too. Bye-bye.